So I have actually been asked to talk about not only data for social change, but one of the briefs for me was to sort of bust some popular myths in this sort of in the development sector when you're thinking about the impact of data and looking at how do you sort of look at data for social change or social good. So I'm going to start by sort of reflecting upon the fact that every year sort of billions of dollars are spent in aid across the world in programs to alleviate poverty. And we also give, I mean, you give, I give, we all give for various causes to what we think is helping others. So how do we know what we are donating to or giving for has the intended benefits to those who need the most? And who need the most support, who need the most push to go to the next level. So what can we do? Do we simply give aid and hope and pray that something comes from it? Impact becomes even more important here to understand if we are making a visible and tangible improvement to the lives of the poor through programs and interventions supported by aid. Alleviating poverty would be mere guesswork with good intentions if we don't use data and science to rigorously test programs to know which development efforts help and, most importantly, which hurt. So how do we typically take these decisions? There's a bit of everything in the mix, as you would know, some intuition, some instincts, some ideology, sometimes even ignorance, I would say. Surprisingly little is known about what works, and a lot of decisions are taken based on intuition and first principles, especially when it comes to development and decision making. So let's take the present situation. The COVID-19 pandemic has been a prolonged public health crisis, among other things. The challenges of low human development indicators, poverty, poor public health infrastructure, low levels of education, population density, all of these compound the threat of a very highly infectious pandemic. And in these circumstances, it is even more vital that we pick the right policies to curb the disease. So the immediate resolution of the COVID-induced health crisis has required the medical research community, for instance, to come together to develop vaccines. And vaccine development has been achieved through the process of rigorous randomized controlled trials. Very large word to use, but this science that has been used for vaccine development is the same science that we at the Poverty Action Lab use for the development sector to explore some very fundamental questions of how to improve institutional responses to some of the world's most critical questions around poverty alleviation and improving public service response. So this is taking the spectrum of how you look at what data you collect and how do you use that data and how do you take decisions based on that. So we are asking questions like, how do we reduce the spread of COVID-19 or how do we use behavioral nudges to adjust attitudes towards vaccine uptake or observing social distancing protocols? The result of research, what we would call impact through rigorous trials on these questions, can provide important insights to policymakers on measures that can help reduce the spread of the pandemic and less its economic impacts. So, for example, there's a lot of evidence now from a very large trial in West Bengal that shows persistent messaging and using sort of what they call celebrity videos on COVID-19 prevention over and above what the government was already doing, increased symptoms reporting and adherence to preventative behaviors among 25 million recipients, with similar effects that were seen on the non-recipient members of their communities. So this is how you're being able to use data and research for impact at scale. So in some spaces, we are seeing this and people responding to evidence, of course, and some these messages. So in some space, we are seeing this shift in responding to data for decision making at a micro level, but also at a policy level. And the need to develop solutions to tackle these deep and persisting impacts across the globe has now brought science and evidence to the forefront of several conversations. So I'm going to argue that the development sector is not just about good intentions, but gradually over the years has adopted a more scientific and data-driven approach to decision-making and impacted millions of lives across the world through scaling up of evidence-backed programs. So innovators and researchers are now thinking differently about solutions with organizations with feet on the ground about how to deliver these solutions, and most importantly, focus on measuring the impact. So I'm going to quickly illustrate a very simple point. So let's take the example from education. In India, before 2020, and before the pandemic, over 96% of children in the ages of 6 to 14 were enrolled in school. And yet, according to the ASAR report, only half of kids in class 5 are able to read grade 2 text. And solve simple multiplication problems and division. So you fast track to 2022, and we're going to see an even more stark learning losses when schools reopen, given that a large population has been left out. So how do you improve learning outcomes? How do we help children catch up? So over the last several years, many things have been tried. From hiring teachers to reducing the pupil-teacher ratio, improving infrastructure, giving midday meals, textbooks, all of these things, right? So as an education minister, I want to know which of these has had the maximum impact and for what value. So my bang for the buck, and quickly deploy them in the current context. So we have now a research base over 1,000 evaluations, a quarter of which is in the education sector alone, which has thrown some surprising results in terms of where we should drive our decisions to invest our money in, actually busting several popular myths that have found their way into government policies in the past. And the big lesson here is that there is little to no benefit of adding resources such as introducing more teachers in a classroom or upgrading libraries or building toilets for girls. So these are all necessary but not sufficient to improve our learning outcomes. So we have done flip charts in Kenya, flexible grants in Niger, libraries in India, textbooks in Kenya. So all of them had no impact on test scores. So, and technology, for instance, is important, but it's not a silver bullet. It has potential, but it's not a silver bullet. Studies have shown that providing access or increasing usage of technology alone is not enough to boost learning outcomes, but programs have to integrate technology into the learning experience of the child, which can then increase learning. The most compelling evidence actually on improving learning is from a series of experiments around tailoring pedagogy to the level of the child, irrespective of the grade and curriculum. That has found to be consistently effective. And this was first conceptualized by the NGO Pratham, and then is now being scaled up in India and Africa in partnership with Pratham. And so this is even more, such an evidence-informed model becomes even more important in sort of today's context of long school closures. I'll talk very briefly about another myth. This is a good favorite example of mine, tackling absenteeism with biometric attendance. So you can see governments all over are using biometric attendance to track absenteeism. So in Karnataka, the government introduced a biometric device to monitor and enforce attendance of doctors and nurses. And the researchers found through a large trial that they conducted of the program that health gains were achieved through the tracking device, which also had the health data of the patients, and it recorded the attendance of doctors and nurses. But the biometric technology alone by itself did not increase doctors' attendance at the primary healthcare centers. So based on this evidence, the government of Karnataka actually decided to roll back the program, saving taxpayers millions of dollars. So this is an example of how the importance of data to understand how the system works as a whole, and paying attention to the human factor in the policy design. So there are a lot of very interesting behind the scenes monitoring data that was collected that showed exactly why it failed. So I don't have the time to get into it, but it's really interesting once you sort of unpack the why of something not working. So I want to now focus the last sort of 2 minutes or 3 minutes I have on some broader key takeaways. So what I've done, so for instance, is to bust a myth in terms of learning, bust a myth in terms of technology, but I want to now what is the broad takeaway here? The broad takeaway here is first, measurement, data and evidence are changing how we understand and address problems related to poverty, and through some of the examples I mentioned, and policymakers, practitioners and funders worldwide are increasingly applying this learning to social programs and policies. So the results have often provided counterintuitive lessons and challenge to status quo. And on some questions, a compelling body of evaluations have generated clear lessons that have fundamentally shifted policy debates across the world. Second, well-designed evaluations can provide insights into not only whether a program works or not, but also why. And in addition to learning about the impact of a particular program, we can draw out sort of the mechanisms of the success and failure. So to help sort of derive general lessons that can be applied also in broader contexts. So I'll talk about the broader context now. So, having timely and relevant data from the ground to inform decisions is important, but it's not always a necessary condition in using evidence to inform your policy decisions. Global research and evidence can play a key and timely role in affecting national policy. We believe in investing in data systems and in collecting local primary data, but we also equally value the data collected elsewhere in the world and evidence generated through rigorous research to draw on global knowledge for solutions that can work in our context. So whether you take it across states in India or you take your learnings outside of India. So we call this using a practical generalizability framework, wherein policymakers or practitioners can use these lessons to inform and design a broader spectrum of programs and policies. Taking us back to the education example that I mentioned, through a series of randomized evaluations in India, Ghana, and Kenya, researchers learned that when children are behind in school, there are a range of cost-effective strategies based on insights of regrouping students by their current learning rather than by by their age. So governments and organizations in other contexts, such as in Zambia, have been able to apply the general idea of teaching at the right level to inform the design of their own remedial programs. So this cannot be done by a few organizations. I think the previous speaker, had mentioned something. I think it was Sudha who was mentioning that there needs to be a platform to be able to learn from each other. There's plenty of space for philanthropy to draw on a host of ideas to inform future investments. And there's a space for think tanks and universities to partner with governments to draw insights from across the world to inform local policy decisions. This is a long-term project, I believe, of creating a true global network that's moving towards a data-driven and impact-focused ecosystem to build foundations towards achieving our next set of global goals. And that is the only way I believe that we'll be able to achieve our targets. While we are learning from the rest of the world is also learning from us. Thank you.